Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
The nurse, while shopping in a local department store, hears a multiparous woman say loudly, "I think the baby's coming." After asking someone to call 911, the nurse assists the client to give birth to a term neonate. While waiting for the ambulance, the nurse suggests that the mother initiate breastfeeding, primarily for which of the following reasons? 1. To begin the parental-infant bonding process. 2. To prevent neonatal hypothermia. 3. To provide glucose to the neonate. 4. To contract the mother's uterus. The correct answer is 4. After emergency birth. The nurse suggests that the mother begin breastfeeding to contract the uterus. Breastfeeding stimulates the natural production of oxytocin. In a multiparous client, uterine atony is a potential complication because of the stretching of the uterine fibers following each subsequent pregnancy. Although breastfeeding does help to begin the parental-infant bonding process, this is not the primary reason for the nurse to suggest breastfeeding. Prevention of neonatal hypothermia is accomplished by placing blankets on both the neonate and the mother. Although colostrum in breast milk provides a neonate with nutrients and immunoglobulins, the primary reason for breastfeeding is to stimulate the natural production of oxytocin to contract the uterus. Which of the following will be most appropriate for the nurse to teach the mother of a 6-month-old infant hospitalized with severe diarrhea to help her comfort her infant who is fussy? 1. Offering a pacifier. 2. Placing a mobile above the crib. 3. Sitting at crib side talking to the infant. 4. Turning the television on to cartoons. The correct answer is 1. Typically, an infant hospitalized with severe diarrhea receives fluid replacement intravenously rather than orally. Oral fluids and food are usually withheld. Although activities such as placing a mobile over the crib, speaking to the infant, or turning on the television may provide distraction for or helping calming the infant, a fussy infant receiving nothing by mouth is usually best comforted by providing a pacifier to satisfy sucking needs. Which of the following instructions should the nurse expect to include in the discharge teaching plan for the parent of an infant who has had an inguinal herniorrhaphy? 1. Change diapers as soon as they become soiled. 2. Apply an abdominal binder. 3. Keep the incision covered with a sterile dressing. 4. Restrain the infant's hands. The correct answer is 1. Changing a diaper as soon as it becomes soiled helps prevent wound infection, the most common complication after inguinal hernia repair in an infant secondary to possible wound contamination with urine and stool. Because the surgical wound is unlikely to separate, an abdominal binder is unnecessary. The incision may or may not be covered with a dressing. If a dressing is not used, the primary care provider may apply a topical spray to protect the wound. Restraining the infant's hands is unnecessary if the diaper is applied snugly. The infant would be unable to get the hands into the diaper close to the surgical site. A client has been diagnosed with adenocarcinoma of the stomach and is scheduled to undergo a subtotal gastrectomy, Billroth 2 procedure. During preoperative teaching, the nurse is reinforcing information about the surgical procedure. Which of the following explanations is most accurate? 1. The procedure will result in enlargement of the pyloric sphincter. 2. The procedure will result in anastomosis of the gastric stump to the jejunum. 3. The procedure will result in removal of the duodenum. 4. The procedure will result in repositioning of the vagus nerve. The correct answer is 2. A Billroth 2 procedure bypasses the duodenum and connects the gastric stump directly to the jejunum. The pyloric sphincter is removed, along with some of the stomach fundus. A client who has had the jaws wire begins to vomit. What should be the nurse's first action? 1. Insert a nasogastric tube and connect it to suction. 2. Use wire cutters to cut the wire. 3. Suction the client's airway as needed. 4. Administer an antiemetic intravenously. The correct answer is 3. The nurse's first action is to clear the client's airway as necessary. Inserting an NG tube or administering an antiemetic may prevent future vomiting episodes, But these procedures are not helpful when the client is actually vomiting. Cutting the wires is done only as a last resort or in case of respiratory or cardiac arrest. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse determines that the son of a client with Alzheimer's disease needs further education about the disease when he makes which of the following statements? 1. I didn't realize the deterioration would be so incapacitating. 2. The Alzheimer's support group has so much good information. 3. I get tired of the same old stories, but I know it's important for Dad. 4. I woke up this morning expecting that my old dad would be back. The correct answer is 4. The statement about expecting that the old dad would be back conveys a lack of acceptance of the irreversible nature of the disease. The statement about not realizing that the deterioration would be so incapacitating is based in reality. The statement about the Alzheimer's group is based in reality and demonstrates the son's involvement with managing the disease. Stating that reminiscing is important reflects a realistic interpretation on the son's part. A client has been admitted to the emergency room. The client's family tells the nurse that the client has suddenly become lethargic and is not making sense. The client has not had anything to eat or drink for the last 8 hours. The nurse further assesses the client using the confusion assessment method. The client's responses to questions are rambling, and the client is not able to focus clearly to answer the nurse's questions. Based on these findings, the nurse should report that the client has 1. Dementia, 2. Depression, 3. Delirium, 4. Dehydration. The correct answer is 3. Based on CM assessment tool, the client has an acute onset of behaviors, is inattentive, has disorganized thinking, and is lethargic, decreased level of consciousness. This cluster of behaviors constitutes delirium. Dementia has a slow onset. The client's level of consciousness is usually normal, and the client can focus attention. Clients who are depressed are alert and oriented and able to focus attention, although may be easily distracted. Further assessment is needed to determine if the client also is dehydrated. The nurse has obtained a urine specimen from AG6. P5 client admitted to the labor unit. The woman asked to go to the bathroom and reports that she feels she has to move her bowels. Which actions would be appropriate? Select all that apply. 1. Assisting her to bathroom. 2. Applying an external fetal monitor to obtain fetal heart rate. 3. Assessing her stage of labor. 4. Asking if she had back labor pains like this with any of her other childbirth experiences. 5. Allowing her support person to take her to the bathroom to maintain privacy. 6. Checking the degree of fetal descent. The correct answers are 3 and 6. The pressure from the fetus descending into the birth canal can cause the client to feel she needs to move her bowels and could be near childbirth. Failure to assess the stage of labor and degree of fetal descent before allowing the client to go to the bathroom may lead progression of labor and could result in a birth in the bathroom. Applying a fetal monitor may reassure the nurse that the fetus is doing well. However, it does not help to determine if the fetus is ready to be born, which is a higher priority in this situation, regardless of the client's prior experience with back labor pain. The fetal head moving lower into the birth canal causes pressure in the lower back area similar to the feeling of pressure with a bowel movement. A child undergoes rehydration therapy after having diarrhea and dehydration. A nurse is teaching the child's parents about dietary management. The nurse understands that the teaching plan has been successful when the parents tell the nurse that they will follow which type of diet? 1. Regular. 2. Clear liquid. 3. Full liquid. 4. Soft. The correct answer is 1. Dietary management following rehydration for diarrhea and mild dehydration would include offering the child a regular diet. Following rehydration, there is no need for the child to be on a special diet, such as a clear liquid, full liquid, or soft diet. When teaching the mother of an infant who has received a temporary colostomy for treatment of Hirschsprung's disease about how the stoma should normally appear, Which of the following descriptions about the stoma's appearance should the nurse include in the teaching? 1. Becoming dark brown in 2 months. 2. Staying deep red in color. 3. Changing to several shades of pink. 4. Turning almost purple in color. The correct answer is 2. Typically, the stoma should remain deep red in color as long as the infant has a colostomy. A dark red to purplish color may indicate impaired circulation to the stoma. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. What should the nurse teach a client about how to avoid the dumping syndrome? Select all that apply. 1. Consume 3 regularly spaced meals per day. 2. Eat a diet with high carbohydrate foods with each meal. 3. Reduce fluids with meals but take them between meals. 4. Obtain adequate amounts of protein and fat in each meal. 5. Eat in a relaxing environment. The correct answers 3, 4, and 5. Dumping syndrome results in excessive, rapid emptying of gastric contents. The nurse should instruct a client to avoid dumping syndrome by eating small, frequent meals rather than 3 large meals, having a diet high in protein and fat and low in carbohydrates, reducing fluids with meals but taking them between meals, and relaxing when eating. The client should eat slowly and regularly and rest after meals. A client with a peptic ulcer reports epigastric pain that frequently causes the client to wake up during the night. The nurse should instruct the client to do which activities? Select all that apply. 1. Obtain adequate rest to reduce stimulation. 2. Eat small, frequent meals throughout the day. 3. Take all medications on time as prescribed. 4. Sit up for 1 hour when awakened at night. 5. Stay away from crowded areas. The correct answers are 1, 2, 3, and 4. The nurse should encourage the client to reduce stimulation that may enhance gastric secretion. The nurse can also advise the client to utilize health practices that will prevent recurrences of ulcer pain, such as avoiding fatigue and elimination of smoking. Eating small, frequent meals helps to prevent gastric distension, if not actively bleeding, and decreases distension and release of gastrin. Medication should be administered promptly to maintain optimum levels. After awakening during the night, the client should eat a small snack and return to bed, keeping the head of the bed elevated for an hour after eating. It is not necessary to stay away from crowded areas. The nurse manager of a psychiatric unit notices that one of the nurses commonly avoids a 75-year-old client's company. Which of the following factors should the nurse manager identify as being the most likely cause of this nurse's discomfort with older clients? 1. Fears and conflicts about aging. 2. Dislike of physical contact with older people. 3. A desire to be surrounded by beauty and youth. 4. Recent experiences with her mother's elderly friends. The correct answer is 1. The most common reason for the nurse's discomfort with elderly clients is that she has not examined her own fears and conflict about aging. Until nurses resolve their fears, it is unlikely that they will feel comfortable with elderly clients. A dislike of physical contact with older people, a desire to be surrounded by beauty and youth, and recent experiences with a parent's elderly friends are possible explanations, but not common or likely. The term motor apraxia relates to a decline in motor patterns essential for complex motor tasks. However, the client with severe dementia may be able to perform which of the following actions? 1. Balance a checkbook accurately. 2. Brush the teeth when handed a toothbrush. 3. Use confabulation when telling a story. 4. Find misplaced car keys. The correct answer is 2. Highly conditioned motor skills, such as brushing teeth, may be retained by the client who has dementia and motor apraxia. Balancing a checkbook involves calculations, a complex skill that is lost with severe dementia. Confabulation is fabrication of details to fill a memory gap. This is more common when the client is aware of a memory problem, not when dementia is severe. Finding keys is a memory factor, not a motor function. The healthcare provider has performed an amniotomy on a laboring client. Which of the following details must be included in the documentation of this procedure? Select all that apply. 1. Time of rupture. 2. Color and clarity of fluid. 3. Fetal heart rate and pattern before and after the procedure. 4. Size of amnio hook used during the procedure. 5. Odor and amount of fluid. The correct answers are 1, 2, 3, and 5. The time of rupture, color, odor, amount, and clarity of amniotic fluid, and FHR and pattern before and after procedure are all information that must be documented on the client's record. There's only one size for an amnio hook. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.